Hi, I'm Marc Gorelick, President and CEO at Children's Minnesota, and I'm here today with Dr. Emily Chapman, who serves as our Chief Medical Officer and Senior Vice President of Medical Affairs. And she has also been serving as the Incident Commander for our Hospital Incident Command System, or HICS, that we have been using during this coronavirus pandemic. So, Dr. Chapman, thank you for being here with me today.
My pleasure, thanks.
So what is HICS? What is this HICS thing all about? Tell us.
So HICS is a really widely used incident management system, and it's used by hospitals, including the military, all sorts of organizations. And it's a way to rapidly pull together resources, sort of an all hands on deck, to address either an impending or an occurring threat of some kind, significant change from your typical operations, something like a natural disaster, mass casualty. It's a very organized system. For those who are clinical, it's a little like running a code. Everybody has a particular role. They hand off from one to the other. In this system, it allows us to very nimbly respond to complex situations. So there are roles that are focused on operations, on logistics and supplies that you're going to need, on how to communicate about the challenge internally, externally, how to coordinate with the city and state, that kind of thing. So in the situation with COVID, this really was the perfect framework for us to try to pull together learning about, responding to, and making changes around something so complex that touched our entire organization.
I really like that code analogy. Certainly in a very high stress, high risk, high uncertainty situation where you have to get things done quickly, you kind of need that very streamlined, crisp kind of system for making decisions. It's a little different than the way we usually do things in medicine.
Right.
It's a much more team-based, collaborative, deliberative approach. How do you make sure in a situation like HICS that you're able to strike the right balance and you're able to be efficient and expeditious, but still make decisions that are consistent with our values as an organization?
Yeah. Well, first of all, what's interesting about HICS is it taps people who have expertise. So it's not necessarily someone who has a leadership title, it's someone who has the knowledge and the know-how, the capability and the availability to get a role done at a given point in time. Mm-hmm. So there is a lot of deference to expertise in it, much like high reliability looks to support.
Sure.
It also pulls together functions often physically in the same room. We were unable to do that with COVID. We had to do it virtually, but physically, and resources to be sort of categorized and cataloged in the same place. So there's a tremendous amount of information that comes up to these section chiefs and leaders. The decisions that are made by that group then do feel top down, but they're not in isolation. They actually are dependent upon that expertise that's being brought to them. Mm-hmm. And they are consistent with the execution of the values, because these are not people from outside of our organization. This is local expertise. Sure. Who has been tapped and pulled in. As I mentioned, all hands on deck has allowed us to bring people into roles that they may never have performed in before, but they lend a perspective that's critical for decision making.
What are some key lessons learned from this mode of operating for the last few months?
Right. I think I'm not sure how we would have responded to such a broad and complex challenge as something like COVID without this kind of a structure. We started very early. Mm-hmm. We had an informal conversation going starting back in January, and then when our first case was diagnosed in the state of Minnesota, we stood up this HICS command center. While pediatrics didn't see a lot of cases, so it's not as though we had an influx of patients like you think of in a typical mass casualty or infectious disease pandemic. We had all kinds of challenges that the organization needed to respond to. And what was tremendously helpful about this was just the coordination and the rapidity with which we could take in information, share it with each other, appoint a decision-making body, and get that communicated out. And what we've learned about that is, while that's not our business as usual at Children's, it can be extremely effective when you're looking at such a complex and ever-changing situation. I will say with HICS, you often are dealing with a challenge that is sort of singular, known, plays out in a matter of hours or maybe a couple of days. So this one is different in that it continues to bring up these new challenges and changes, and this system allows us to respond to that with much more flexibility and in a nimble way that we might not otherwise in our typical organizational structure.
Well, of course, we're not going to be in crisis mode forever, but it does seem like this COVID-19 disease will bring some long-lasting changes beyond just this HICS structure.
Right.
What are some of the changes that we can expect as a result of this COVID-19 for the organization?
Yeah, so COVID-19 has done a few things. One is it has really accelerated changes that we expected to occur in healthcare over the next several years, and it brought them all into 2020. What we saw really was a dramatic shift in how people interacted with healthcare systems, what consumers were looking for from us. We saw a dramatic decrease in health care seeking behavior, an avoidance of hospitals and clinics for fear that they may not be safe. We saw a demand for virtual medicine, and particularly a demand to meet the patient where the patient is, address what their needs are in that time, do it efficiently and effectively. And we have talked about that at Children's. We've talked about the value equation where we're delivering excellence and we're doing it with a responsible allocation of resource, basically. It's quality of care over the expense of the resource to get it done.
Right.
But suddenly in COVID, everything pushed forward. We also anticipate that as this disease starts to wane in our country, that all sorts of changes that it brought about are not going to go anywhere. We know that consumers have started to see a different way to interact with the healthcare system, and we expect that we will see continued decreases in volumes and less of a willingness to come to us for care rather than asking for the care to be delivered to them. We're also expecting, frankly, a real challenge on our entire community, our country. Likely a recession, likely record unemployment for a period of time. And we know that in those times, we also see dramatic changes in healthcare. We see a decrease in accessing healthcare. We see we see people losing their insurance coverage, more and more dependent upon government plans. We know that while government plans like Medicaid are a tremendous safety net for our community, they also reimburse healthcare organizations like ours at rates that are below what it costs to offer that care to patients and families. We know that birth rates tend to drop significantly in times where there is economic stress and recession. So all of those things are going to be associated with what is fundamentally something we're very accustomed to, which is an infectious disease. But what follows it is going to be a real challenge for all of us in healthcare.
Yeah, you mentioned some of the things that have been brewing for a while that have sort of been accelerated. For years, we've been trying to convince people not to, for example, go to the emergency department if they don't need to.
Absolutely.
During the pandemic, they took that advice seriously. It seems likely that now that they're used to that, that will continue. And of course, you know, all the things that we do to prevent COVID-19, like our social distancing, like we're doing now, and masks and stuff, that prevents a lot of other things, which is great for kids. But it may, for at least some time, really depress the need for medical care for those.
And it'll be interesting to see what happens in the fall, because we recognize that with school closures, with social distancing, with mask wearing, we've had a dramatic drop off in other infectious diseases like RSV, bronchiolitis, like rotavirus, vomiting and diarrhea illness,
Right.
those kinds of things, our emergency room volumes are just about half what they typically are at this time of year. And that's a dramatic change. It's a very effective management of community disease, but it's a whole new landscape for us as a healthcare organization.
You know, it occurs to me that one of the other trends that's been building for a while that has been sort of accelerated or brought more to the surface by COVID-19 is this issue of health disparities and inequities.
Absolutely.
And we know that the disease has been disproportionately impacting communities of color. Can you talk a little bit about that?
Right. Well, that's the other thing that that I think we'll see in the wake of COVID is an exacerbation of the healthcare disparities. And as you know, we're not in a position to let that be any worse than it already is. We are seeing that not only is COVID more active in our communities that are people of color, less resourced, but it is also causing greater morbidity and mortality in those populations because of coexisting comorbidities that are in place after years of systemic racism in how we resource those communities. So sadly, at a time when we were trying to address what were already unacceptable disparities, we're seeing a progression, a worsening of that. And so that's going to be something that we all are responsible to address in the wake of this.
You know, I think that one of the words that we're using a lot these days is resiliency. You know, the need to be resilient. We've been very resilient as an organization. We were faced with an enormous challenge starting in March. We're not quite out of it yet, but we've been very resilient. We've been able to rapidly mobilize change that we always pride ourselves on being kind of change averse, not pride, if you will, but we did it. We stepped up. To the point you made earlier, people who haven't previously led are now leading. People are doing things in a different way. So this pandemic, if nothing else, has really taught us as an organization we're going to be resilient. And from what I'm hearing you talk about, we're going to need that resiliency going forward. The disease may wax and wane, but some of the changes that we've been faced with are going to be with us for quite some time. Changes in healthcare seeking behaviors, changes in disease patterns, changes in the way we function as an organization. It's been great to see you and your team, the way you've helped drive that resiliency through the incident command structure. And so I appreciate everything you've done to help get us through this and taking some time to talk today. Thanks, Emily.
Thank you.